Nosocomial infections. Nosocomial infections, also known as hospital-acquired infections, are defined as infections acquired in a hospital by a patient who was admitted for a reason other than that infection. Nosocomial infections, also known as hospital-acquired infections, are defined as infections acquired in a hospital by a patient who was admitted for a reason other than that infection. To meet this definition, the infection must not be present or incubating at the time of the patient's admission, and the clinical symptoms must appear at least 48 hours after admission. This definition is a comprehensive and also include infections that are acquired during hospitalization but only become clinically evident after the patient has been discharged, as well as occupational infections acquired by the staff working at the hospital facility. Nosocomial infections are typically classified into three ways. By the way, source of the infection, by the route of transmission, and by the clinical syndrome, the affected site. Nosocomial infections are typically classified into three ways: by the source of the infection, by the route of transmission, and by the clinical syndrome. The first, classification by source of infection. Classification by source of infection. Endogenous infection, like self-infection, endogenous infection or self-infection. A high proportion of clinically apparent hospital infections are endogenous. This means the infecting microorganism is derived from the patient's own normal microflora, primarily from the skin, gastrointestinal tract, or upper respiratory tract. These microbes may spontaneously invade the tissues or be artificially introduced into the sterile areas during surgical operations, instrumental manipulations like catheter insertion, or nursing procedures. Exogenous exogenous infections. These infections originate from sources entirely outside the patient's body. They are further divided into a cross infection or cross infection, the spread directly from another person in the hospital, such as an infected patient, a visitor, or an asymptomatic member of the hospital staff. Environmental infection, the spread from the inanimate hospital environment, which include contaminated medical equipment such as endoscope, catheter, needle, building surfaces, dust, air, water, and hospital food. Classification by a route of transmission. Classification by route of transmission. Contact transmission. This includes direct skin-to-skin contact, which is the most important and frequent mode of transmission, as well as indirect contact via contaminated hands of healthcare worker, dressings, gloves, or unsterilized instrument. Contact transmission. And airborne transmission. Pathogens can spread through respiratory droplet, airborne droplet nuclei, or dust from bedding and the natural shedding of skin scales. Aerosols produced by nebulizer, humidifiers, and air conditioning systems can also transmit specific pathogens like Legionella directly to the respiratory tract. Parenteral route, inoculation, parenteral route. The bloodborne infections like HIV, hepatitis B, hepatitis C can be transmitted through contaminated blood transfusions, tissue donation, contaminated infusion of fluids, or accidental sharp needle stick injuries. Oral route, hospital food and water can become contaminated with antibiotic resistant gram negative bacilli such as Pseudomonas aeruginosa and E. coli, which can colonize the patient's gut and later cause infections. Classification by clinical syndrome, infection site. In any hospital setting, the four most common HAs are encountered. That is urinary tract infection, UTIs, accounting for approximately 33% of all hospital-acquired infections. These are most frequently associated with urethral catheterization. Common bacterial agents include Escherichia coli, Klebsiella, Proteus, and Pseudomonas. Respiratory infections, pneumonias, accounting for roughly 15% to 20% of hospital infections. These frequently occur in patients with pre-existing cardiopulmonary disease, unconscious patients who aspirate or through pulmonary ventilation, leading to ventilator-associated pneumonia. Surgical site and wound infections. Accounting for about 15% of HAIs, these typically emerge within a week of surgery, though non-surgical sites like burns, ulcer, umbilical stumps are also heavily susceptible. Staphylococcus aureus is the predominant pathogen for general wounds, while Pseudomonas aeruginosa is the most important cause of infection in burn wounds. Bloodstream infections like bacteremia and septicemia, accounting for 13% of HAAs. These systemic infections are most commonly caused infected intravenous cannulae or central line vascular catheters. Gram-negative bacilli and staph epidermidis, especially in patients with artificial heart valves, are common culprits. So, nosocomial infections, classification by source of infection like endogenous infection like self-infection, exogenous infection which include cross-infection and environmental infection. Classification by route of transmission, contact transmission, airborne transmission, parenteral route, inoculation, oral route, and classification by clinical syndrome, urinary tract infection, respiratory infection, surgical site and wound infection, and bloodstream infections.